Hello once again for those who are in our part of our community and for those who are joining us for the first time. This is your well and your home of inspiration. We are here to inspire you to hope. The reason why I do what I do is because I have been through the journey and I have needed people to handhold me or to point me to a direction or to point me to the way. I mean, I didn't just find myself here in the UK as a settled citizen or with an indefinite leave to remain together with my children, just like that. There were people who supported me, who supported my journey, who pointed me to where I could find information that I was seeking for, or even for opportunities that were here. I relocated through the skilled worker route. So it is a route that I am so well familiar with. I've done a lot of study. I have done my research, for the 5 years that I have been here, just checking how the government regulations have been changing from the time we came or even before we came, because I had to do my own checks and background checks as well. So I am sharing from my experience. I am not an immigration lawyer. I'm not a solicitor. If you want to make decisions that are well advised, please consult your lawyer, consult your immigration advisor, and let them advise you on what you need to do. Now, there has been a number of people who've been asking me why there are people that are out there charging hefty fees and whether they should pay. The bottom line is, I don't know, but I will show you what I know and what I have read from my research and from what the government is saying. It is up to you to make your decision and see whether you will pay or not, and even how to identify companies that are legit, because there are so many out there that are not legit and are offering opportunities, and yet the truth is they do not have these opportunities. They just want to take advantage of you. Do not allow anybody to take advantage of you. Do not allow anybody to charge you hefty fees. And yet what you're coming to earn here in the UK might not even sustain you and your family. I mean, some of the jobs here, in as much as you think £20,000 or £30,000 is a lot, remember you have to pay your taxes, you have to pay your bills, and you have to sustain yourself. And if you have a family like I do, it is not easy. So if you're borrowing money to pay those hefty fees, it is really up to you. Make informed decisions. Now, I will go ahead and share with you what I know and what I have read from my research. The government of the UK has what we call, and every organization has what we call, and I will share that link down here in the description, a code of practice for international recruitment of health and social care personnel in England. And this sets out clearly what recruiters should do, or what recruitment firms should do and should not do. And I will share the link with you so that you can read. You can read the objectives of this paper, the scope, the code of practice, the list of agencies as well, which I have shared in another video, and I will put a link down here. You read everything that you need to know, understand who NHS is, the different departments that are there, and the guiding principles and what they say. There are 5 guiding principles that underpin the code of practice, and we have agreed the code of practice guides the different agencies or recruitment firms on what they should and should not do, that international migration of health and social care personnel can make a contribution to the development and strengthening of health and social care system, both in the country of origin and destination country, if recruitment is managed properly, and it spells out what that or that is. And the second one as well, opportunities exist for individuals and organizations and healthcare systems to train and educate and enhance their clinical practice. And we have so on and so forth. There are also, and this is where I want to go, there are best practices, the best practices benchmarks, which it is expected that the best practice benchmarks in this paper, it is expected that all health and social care sector organizations and recruitment agencies that comply with the code of practice will apply the best practice benchmarks set out in this section. The best practice benchmarks should be read in conjunction with NHS Employers International Recruitment Toolkit. And the link is right there. Now, the toolkit is designed to encourage and enable supportive practices and processes for recruitment for international staff across a wide range of professionals. And we've talked about those professions in another video, and you will see it down here. Now, what does this benchmark or best practice benchmark say? There is no active recruitment of health and social care personnel from the countries on the list. And this is a list that is spelled out by WHO Assembly. And right now we have countries which are in the red list, that where you cannot recruit people. Make sure that you familiarize yourself with the countries where recruiters or agencies are supposed to recruit from. If your country is not in that list, do not pay those fees. Wait until when you're eligible. Number two, all international recruitment by health and social care employers and contracting bodies will follow good recruitment practices and demonstrate a sound ethical approach. And you can read what that is all about. The third one is international health and social care professionals will not be charged fees for recruitment services in relation to gaining employment in the UK. It is against the best practices, and it is very well spelled out here. And what does it say? Because this is where we have issues. Applicants will not be required to pay any fees to any recruitment agencies or other bodies to gain employment. Any costs incurred by recruitment agencies will be incorporated in the negotiated fees charged to employers and contracting bodies. At the employer's discretion, visa costs to exit their home country or enter the UK or any other professional registration fees would normally be met by the health or social care candidate if applying independently, and by the employer if through active recruitment. This is if you are applying directly to maybe say a care home, then they can choose to charge you, or not to charge you. They can choose to allow you to pay for your recruitment fees. That includes your application fee, your travel, if there are any, like checking whether your English certification or you meet your English requirement, you can pay for those services, but only if you are applying directly to either a care home or to the NHS or any other agencies directly, but not through a recruitment firm. Not through a recruitment firm. That is what the government says. Employers and contracting bodies will not contract agencies that charge fees to candidates for them to be considered for recruitment in the UK. Agencies that subcontract to agencies outside the UK should not be used if that agency from outside of the UK charges fees. It's up to you to pay if you want to pay, but this is what the government says, that you're not supposed to be charged. If you see people charging hefty fees, question it and show them this code of practice as your pointer to show them that they are not supposed to charge you unless you are applying directly to a care home or to a farm for employment yourself, and you're the one submitting the application. There are people who could charge you to either check through if you're applying independently, for example, and you need someone to check for you whether you've made the application correctly, if you've put all the documents that are required, or guide you through the application process. That could be different, could be treated as different, because then you're using this person's time. But make sure that this person knows what they are doing. There are legal firms out there that can help you go through the recruitment, the whole recruitment process, and that are allowed by the government to charge, but not recruitment firms. Okay? All international health and social care personnel will have the appropriate level of English language to enable them to undertake their role effectively and meet registration requirements from appropriate regulatory body. And all appointed international and health and care personnel must be registered with appropriate UK regulatory body. And I'm not going into all that. Or international health social care personnel required to undertake supervised practice by regulatory bodies should be fully supported in this process, and employers know that. And there is the whole guidance out there. All international healthcare personnel offered a post will have valid visa before entry, and we've talked about that. That you need a visa. You cannot come to the UK if you do not have a visa. So I will attach this kind of practice so that you are able to go through it, read the case studies that are listed there, get to know what the government says. And here there is a whole list of countries that are eligible. WHO health workforce support and safeguarding list. You can look at it, and as I said, there are countries that are in the red, amber, and green rag, and in the red countries there is no recruitment that is permitted, and there is an annex that has the whole list. Of course, to check if that has been updated. Others that are in amber, and others that are in green, and different countries have different categories, so to say. So make sure that you read through this document. Like this is the countries that were in amber, and red, and so on, and make sure that you make use of it. So this was a short one. Make sure that you read the code of practice for international recruitment of health and social care personnel in England. The link is down here for you to read for yourself and understand it before you pay those hefty fees. Okay, bye-bye. Please do remember to subscribe and share with your family, share with your friends. Who knows, this might be the opportunity that they have been looking for. This is Lydia. She inspires all. And I once again to remind you that I am a coach. If you need coaching services, if you need a guidance, if you need a mentor, I am right here. And I will drop my email in the description so that you can reach out to me. Bye-bye.